it really gave me a lot of mental instability. Reporting daily on issues, on problems that seem not to be getting any better uh, with time or with our reportage. And that was really eating at me until, fortunately, I was introduced to solution journalism.
So imagine that's, at that particular moment when one is taken to the delivery suite and she's pushing, the health workers are there trying to get her to, deliver the child. They're supporting her. And all of a sudden, bam, everywhere is dark. Okay, so welcome to another edition of Journal Conversations by Nigeria Health Watch. This essentially is where we get to talk to colleagues, experts who are on the ground reporting from different countries across the continent. And the whole idea is simple, right? To learn from each other, because we know and we believe that all of the issues that we are talking about every day, the conversations that we are championing, that we are trying to advance. We are not the only ones facing all of those challenges, from Nigeria to Kenya to Ghana to Zimbabwe to Uganda, South Africa. We are facing similar challenges, and we are making efforts, individuals, government, private sector, academia, just doing what they can as a community, as stakeholders who these issues affect. So the question is, how are we learning from each other? How are we promoting cross-learning? And that's essentially what Journal Conversation is trying to achieve, right? As one of the strategies, we do this with a mix of, different ways, from events that we convene to stories that we do collaboratively with journalists in other parts of the country. But at the foundation of all of this is that core question: what can we learn from each other? How are they addressing these issues? How are these different issues showing up, manifesting in their different climes? So that's Journal Conversation. And I am Chibuike Alagboso, and I'm glad to be hosting today's edition. And I have two amazing guests with me. Interestingly, they've done a collaborative story together on a very important topic. So we'll be diving into that to sort of hear what inspired them, to do that story, the story behind the story, essentially, and what they have seen or what they are sensing, or, what's been going on since they reported that story, and other associated factors. So I'm glad to welcome two great guys to today's edition. Hi, Farai, Kenneth, can you introduce yourselves and let our listeners know who you are and the work that you do? Farai, you can go first.
Okay. Hello, everyone. So my name is Farai Shawn Matiashe. I'm a journalist based in Maternal, Zimbabwe, and I'm a stringer for various international media outlets, including Al Jazeera, CNN International, The Economist, African Business, as well as the Africa Report. And I cover quite a number of issues, including health, renewable energy, climate change, as well as environment. And I mostly report from the rural areas. Thank you.
Interesting. Thanks. I'll come back to that later on, the rural area parts that you mentioned. But just before we get into that, Kenneth.
I'm Chinonso Kenneth, and I'm an international freelance journalist, writing out of Abuja, Nigeria, and also the founder of the Solutions paper, which is a solutions focused newsroom, out of Abuja as well. And I mostly do solution and constructive focused stories around health, majorly, and religious tolerance, environmental, and gender equality as well.
Nice. Thanks for joining us. And just to put it out there that we're recording this remotely. Chinonso is joining from Abuja. I am also here in Abuja recording, and Farai is joining us from the eastern part of Zimbabwe. What's that city again, Farai?
The city is called Mutare.
Nice. Which state is that in?
We have provinces here. So it's yeah, it's in Manicaland province.
Oh, cool. So why rural? Because that's one of the things you mentioned in your intro. Is it a personal preference, or maybe as a result of where you find yourself, reporting from mostly?
So for me, it's a personal preference. So you would see that most of my stories are in depth. They are well researched. We go beyond surface reporting. So let's say in Harare or in Abuja, there is a minister announcing a policy on health, and most of the journalists will just report about that policy from the perspective of the government minister. But for me, I'll go beyond that. I'll go to the rural areas uh, to speak to the people who are going to be affected by this policy, and I will report from their own perspective. These are the people with great stories, the people with amazing stories. You don't see them in the day to day news. They are rarely covered because it involved. A lot of effort, a lot of time, a lot of investment in terms of funding for you to get to where these people are. So that's what defines me. That's what I focus on.
Interesting. And no, so how about you? Why solutions? What inspired that for you to focus on more? Focusing more on solutions reporting.
So I used to work in a very fast-paced daily newsroom, and to be honest, it was good and it was great work. We were doing development reporting at the time, but it was daily and it was fast-paced, and it really gave me a lot of mental instability having to juggle that amount of tasks, and also seeing the reporting daily on issues on problems that seem not to be getting any better uh, with time or with our reportage, and that was really eating at me until fortunately I was introduced to solutions journalism by the legendary Mr. Innocent Eteng, and I've never looked back since then, because it not only helped my reportage, but it also helped my mental health, because I felt like I was no longer spotlighting problems, but I was actively contributing to solutions, with my reporting.
Oh, nice. So I'm going to be going from where what you talked about now, Chena. So just reporting solutions, why that matters to you, how it all started. So now diving into the story that you two reported on, actually, and it's a solutions focused, but from a collaborative lens. So you looked at it from different country perspectives. So how did you come about that story?
Um, so we wrote that story around November, December last year. So it was again typically in the really middle of the dry heat season, in Nigeria, and I believe across most of Africa as well. And and yeah, thanks Nigeria Health Watch, we would put out a call for collaborative pitches. Started doing some research on um, health problems that are not just domiciled in one clime, but are actually shared across the African continent, and we were able to. It was pretty easy to identify such problems. That is shared across our different geographical area, and that was how we're able to connect with Farai, and from the beginning, it was clear that the story would be valuable because again, these issues were shared across borders, not just in Nigeria, but also in Zimbabwe, with almost similar solutions or responses taking place. Yeah.
Yeah, thanks. So I guess we're just sort of saying it without saying it. So someone listening might be wondering, oh, what are we even talking about? So I'll just try and paint a picture. So imagine you are in a health facility, right? A woman is trying to deliver a child, a baby. And at that critical moment and this is late, right? Late at night, say 8 p.m., 9 p.m., midnight, because you never can say when that moment comes. So imagine that's, at that particular moment, the woman is taken to the delivery suite and she's pushing, the health workers are there trying to get her to, deliver the child. They are supporting her. Maybe a family member is there. And all of a sudden, bam, everywhere is dark. You can't see anything at all. How do you picture that? Is this something you have heard about before? Is this something you have experienced, or maybe someone has told you such stories? Is this something, what do you think about such a scenario, essentially? Farai?
Yeah, so this is actually it's very sad, but it has been it has been very common in Zimbabwe as well as other countries in the region, because we have been facing a series of droughts. Some of the droughts were caused by were worsened by El Nino, and I've talked to health workers as well as some of the mothers who have experienced uh, this scenario. So I remember back in 2019 when we were having power shortages across the country. The water levels at Lake Kariba, the country's biggest hydropower plant, had gone down, and we were facing problems. So, women in at general hospitals as well as in council clinics, they had to give birth, using candle lights. I remember speaking to one nurse who told me that at some point, because there was no power, and she was helping she was assisting a woman to deliver, and then she had to use the torchlight from a phone, uh, so that health professionals can see. I think, like, these are very common story as you move from one hospital to another. I think it also happened in Chipinge in Hakatwa, where this story was written, just before the NGOs intervened. A similar case, happened, and it's it's very sad.
Wow. So I mean, I can't even imagine it. I can't even imagine being in a room where that happens. That's really scary, but also very sad. And to think that we have governments who are responsible, right? We have um, policymakers who campaign, who say, oh, they are going into power to help make the society work, and they get in, and most times, you know 80, 90% of the time, nothing changes. And that leads to non-profits coming to plug that gap, which you mentioned. So, but going away from that, which essentially, yes, we know the issues and we talk about the issues, but we also want to talk about what's working, right? Tell me about what's working, something that is working, something I know you reported on. How did you come about it, and what's your feel about the intervention that is trying to help address this, Kenneth?
Uh, yeah. So We Care Solar has been working in Nigeria since around 2008, 2009, and in a very specific niche area that I find really interesting and creative. Even though, of course, there would be some loopholes, but it's a very niche area. And what they do exactly is work with primary healthcare centers to power up their maternity wards with off-grid solar energy. And a very interesting story to the beginning of how We Care Solar came into existence. It was during Dr. Laura's Stachel's postgraduate research in Nigeria around 2008. Um, she was doing a research at Kaduna State in a hospital called the Gambo Sawaba General Hospital in Kufang, Gaya. And during her research, she was able to identify and observe uh, how power failure, or how power outages, affect the maternity wards, and especially is indicative of high maternity rates at that particular healthcare center. And moved by this, unfortunately enough, she had an engineer for a husband, and she collaborated with him, and they actually built the first of what they call a yellow suitcase. And this yellow suitcase is uh, a so it has a lithium battery, and you know, including a fetal Doppler. Uh, it's used to check the heartbeat of 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 children in the womb, or the fetus. Yeah, yeah. So it also comes with two solar panels, and a battery, rechargeable battery, as well as sockets and high powered torchlights that are also rechargeable. And these yellow suitcases with the solar panels are installed in maternity wards, and they help to power this maternity wards all night long. And because of the lithium battery that these yellow suitcases possess, they are very durable and strong. So 12-volt capacity LED lights, very efficient LED lights, and they have been helping PHCs. For instance, before this intervention, and for your knowledge, they have installed over 580 of these yellow suitcases in over 560 primary healthcare centers, across different catchment areas in Abuja and Kaduna, and also reached about 5 million women so far, preventing what could have been a disastrous, maternity rate in Nigeria. Um, yeah, and so before this intervention, when I spoke to some of the nurses at Kuchigoro PHC, and Lugbe, and even in Gwagwalada, they all confirmed that they've had instances where they had to use candles, they had to use their phone torchlights, to take deliveries, and even had to turn women away, because of course there was no power to do this. But with the yellow suitcases,
Right.
maternity wards are always lit up. They have power, and for lights, and they told me they were using rechargeable lamps. I've used several rechargeable lamps that sometimes even go off in the middle taking an operation. Imagine you are delivering a woman of her baby with a torchlight, and then it just goes off.
Yeah,
You know,
it's very difficult. It's really difficult to imagining that.
very,
But
very
yeah,
traumatic for the
thanks,
nurses as well.
thanks. I mean, I'll
Yeah.
come back to you on sort of how they're able to fund this, but just before we go there, Farai, what's the what did you find essentially in Zimbabwe, your reports? And just to, I know the cities she also mentioned, them Lube, Gwagwalada, Tinkuchingoro, they are all cities in Abuja, Nigeria's federal capital, right? This is the federal capital we're talking about, where these issues are prevalent, and this intervention is now trying to help. So you can imagine what others are facing in other cities or states that are even farther from the seat of power. That's just interesting to just think through that. But yeah, Farai, what's the situation, or what did you find in?
Yeah, yeah. So we also have Wiki. They've been doing quite a number of things here in Zimbabwe. They also, give these yellow suitcases to different hospitals across the country. But UNDP has also been doing a lot of interventions. So they've installed solar systems at government hospitals, as well as council owned clinics. But in Hakatwa, there is something that was unique, because this part of the country, they are one of the remotest. It's one of the remotest areas in the country. They are off grid. I remember having to use an off road vehicle, from the highway. Going there, they are close to the border with Mozambique, and it was really difficult. They don't have, they are not connected to the grid. There is no network there. The area is so remote. It's highly mountainous, and UNDP has installed a 200 kilowatt system there. So they've connected something like about 8 households. The system works the same way with our power systems in the cities. So they've got like a power plant, a solar power station with some lithium batteries and some solar panels, and then they've got some power lines, uh, moving, transporting, moving electricity from the plant to distributing it to different households. There's a shopping center, and there's also a clinic, which is benefiting. And one thing I like about this is, it's sustainable in a way that these households, they pay a little compared to residents who are connected to the main grid, so that the money is used, keep for maintenance costs, and other issues, just to keep the system running. And they are actually better than those who are connected to the grid, because uh, we we always have power outages. And for these guys who are using solar, who are using the mini grid, it's electricity is always available.
Right, thanks. I like that you mentioned the payment part, because yes, while these interventions essentially they are there to solve the core problem, right? The fact that these PHCs lack reliable energy, especially in rural areas, not just even peri-urban areas, clusters of spaces that are close to the city. But essentially, the bigger issue here is, people can't deliver at night using some basic medical equipment, like the example you shared, so that, the box comes with the fetal Doppler thing that you can use to check, monitor baby's heart rate and all of that. So you can't do all of that if there's no electricity. But because this is there, that solution or intervention is that you're able to do that. But also even storage, which is of course a bigger issue, a bigger conversation that we can't even get into, because there are certain medications, vaccines, that needs to be stored at certain temperatures, right? And at the end of the day, all of this, we know how it's impacting women and delivery and all of that. But even as these solutions, are there trying to provide, backup power, sometimes they are the only available power. But also brings up the question of sustainability and what the government is doing in those spaces. Because like I said, these are like stopgap measures. Yes, when you find gaps, usually that's the mindset of an entrepreneur. If you find a problem, you try and find a solution to it, and people will be willing to pay for it. But that brings up the question: who is paying for this? So now, so you mentioned this is given to the PHCs. Who is paying for it? How are they able to sustain it? And Farai, you also talked about the fact that there's a certain fee. People pay. So just looking at all of this in terms of which is more sustainable, right? I'm curious to know what you both think about, sustainability in terms of the models, how these two interventions are designed and deployed.
So for the yellow suitcases, they're essentially donated to PHCs and primary healthcare centers, funded and run by the government. Uh, but then again, being that this yellow suitcases then originates out of a government initiative, it might be hard to assess for the PHCs to assess a budget to maintain these yellow suitcases, the lithium batteries, the solar panels, the LED lights, and the fetal doubler, when there are maintenance issues on hand. But I want to believe that PHCs have a budget for maintenance, right? But again, I'm just a bit curious, since it didn't really resonate from the government. What the procedure might be for the maintenance, but I must say that the nurses at these PHCs are very they have good maintenance culture, and they are very proud of this yellow suitcase, because sometimes at night, 12 a.m., 1 a.m., when there's power outages in PHCs, it's only the maternity wards that have lights, and they can even charge some devices and other stuff. So they are really protected of this. The yellow suitcases are mounted on a wall and then cased with, with an iron protection, and the head nurse has the key to it. It's kept under lock and key, and it's used only as when needed and necessary. Uh, and so I believe they are really by ownership, they are doing their best. But then when it comes to replacing some of the component parts, that might be an issue, which is where I defer to the Zimbabwean model, where there is already a fee on ground that that keeps up some emergency funds for these
Yeah,
repairs.
cool. So essentially, I guess it's donor funded. From what I hear you said, since they donate this to the PHCs.
Yeah, it's donor funded. Yeah, from the USA, and and UNICEF and others. Although they have also been severely impacted with the cut in donor funding. And but one creative thing they have done is now collaborating and liaising with government to pay for these suitcases and then do the installment and training of nurses. So they have been working with the federal government in Abuja to roll out more in around the Abuja metropolis and rural areas as well as Kaduna and other Sokoto and other frontline states with high mortality rates.
That's interesting. And I mean, to be curious to know how, especially for facilities that are getting the funding. I know the funds for Q1 of 2026 have just been disbursed. The Basic Healthcare Provision Fund. If this is something they can invest in, especially as far as I understand, this is a one-off engagement, right? There's no reoccurring cost. It's just one-off to get the system and perhaps maybe when the battery dies, but that doesn't happen. It's not like it happens every day, the lithium
Yeah,
batteries.
yeah,
Yeah, but
yeah,
yeah,
you're
that's
spot on.
yeah,
Yeah.
that's cool. So how about you, Farai? What's I know there's a fee, sort of a fee for service or something that you mentioned, but how does it work and how do you think it will impact on that solution or intervention long term as far as sustainability goes?
Yeah. So, as I mentioned before, that UNDP has been installing small solar systems at both government-owned and council-owned clinics. So, I visited one clinic here in Mutare. I think they've got something like an 18 kV solar system. And then I asked the nurses if the system was working, and then they told me that they were having issues with some batteries and other cables. And then I asked why is it that the council, the local authority, did not send in their engineers to fix the problem. And then they told me that no, the people who installed this system actually came from Harare, and the local engineers, they were not taught how to fix any problems, so they don't know. It's been sitting like this whilst we are waiting for people to come from Harare. And so look, with the with the with the impact of funding cuts, you might that system might just sit there and it might never be repaired because there's no funding to bring in some experts, some engineers from Harare to come and fix the problem. So that's it's been a challenge, like throughout the country. So with this off grid, the donor the donor UNDP worked with the government. So we have got an agent responsible for rural electrification in Zimbabwe. So they worked together with the UNDP, to set up this system. They were using engineers from this organization, to electrify this community. So they are the ones who are managing the system. The donor actually they funded the initiative and then they left. And then the government is now in charge through these agents. So the communities, these 8 households that I talked about, they pay they pay electricity just like we do, in urban areas. You buy a token, from the power utility company, and then you get your power, you use it up until it's depleted, and you buy again. That's how this system is working. And I asked, what is the purpose of this? Because renewable energy is free, is always available. But then they told me, no, these lithium batteries you're seeing, they've got a lifespan of somewhere around 15 years, and the solar panels can stretch up to 30, 35 years, somewhere there. and at some point they would need to be replaced. You need to replace some batteries. You need to replace some power panels. There is also some security guys who are looking after the panels. These guys, they need to be paid. And also, the thing of community ownership. They want the community to own this project. That way the project can last, because they take it. It's part of their lives. They guard it with their own lives. They make sure that the system is working, because if women are now giving birth in a well lit maternity ward, you wouldn't want to to see the system not working. You do whatever you do to ensure that the system is working. That's how sustainable this project is.
Interesting. Thanks. So, I mean, this has been interesting conversation. Just hearing um all of the different ways it's the interventions play out, the ownership. I like that part because it's always been one of the issues as far as interventions are concerned. Who owns it to make sure that it's sustainable? Because whoever is bringing that intervention, in this case, either a non-profit or a social enterprise, they are not going to be there forever. So how do we make sure that it stays when they are not there? And it's really interesting to see, that ownership, in as much as there are a couple areas that can, you know, that improvements can still come, right? Especially around issues of funding to make sure that it can scale, maintenance when there are technical issues, like you mentioned, Farai, and essentially scaling it to other places, right? This has been interesting. But so now looking at both countries, right? You did this story collaboratively. There was the Nigeria side, there was the Zimbabwe side. So maybe you now, so imagine you are now facing each other in the room and you're talking to each other. So what is one thing that you think that you liked from both sides? Is there any, if it's not compulsory that you must like something? So is there anything that you like from the other side? So Chinonso from the Zimbabwe side, Farai from the Nigeria side, how how they are going about there. So how that particular um non-profit, is addressing this challenge. Because of course there might be others. There will be others who are also trying. It can't be just one person. But for the purpose of the reports, the investigation that you guys did, is there something you liked or something you think they could have done better?
Uh, So I think for me, I again like the fact that the whole upgrade initiative, came up as a partnership between the government and an international nonprofit, and I believe that is what will lead to its continuity and community ownership. It wasn't just a one-off. There was an actual purpose, to come together between the government and a non-profit to do this. I say this because I believe to solve, this problem around maternal mortality, around, energy source and stability for healthcare centers and healthcare in general. I believe there has to be concerted effort, not just silos of responses from government on one side to non-profit or the other, and individuals on another side. It has to be coordinated, comprehensive, and concerted. So I like the fact that this initiative was bettered, from a collaborative point of view, between the government and
Yeah, I mean it's collaboration, 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 essentially. Farai, how about you? Anything or something? It can be on the other
Yeah,
side too.
I think I like the fact that the we care, a non-profit is working hand in hand with the federal government. I think collaboration is the way to go. And I also like the fact that Chinonso brought up of ring fencing, because these suitcases, they're ideally made for maternity wards, and at a hospital, in as much as everyone in the hospital is affected by these power outages. I think a woman who is giving birth or who is about to give birth is the most affected, and you wouldn't want to deliver a baby in a dark room. So the fact that these yellow suitcases are mounted on a wall, that's ring fencing. Because in my country we have a problem. We have got like a problem where taxis, like I can give you an example of sugar tax, which is meant to buy equipment like cancer machines, but the money is not ring fenced. It's ending up being used somewhere else. So I think this is a great lesson that other African countries can learn from this project in Nigeria.
Interesting. Thank you. I like that you ended with that because that's essentially why we're doing this. Learning, cross learning, sharing with others. So we are learning from what others are doing. So just to end, if you had one opportunity, so if you're going to, maybe you are in a convening and you are able to speak to a policymaker across from any African country, maybe your own country or another country, is there something that you want them to, do now? Anything to avoid losing more mothers, especially due to something as simple, really simple as, well, maybe not so simple as electricity, or maybe on other causes, really, to reduce maternal mortality. Because at the end of the day, that's where all of this, conversation has led to having steady power supply in primary healthcare centers to support deliveries, to support women when they're at a very vulnerable moment.
Hmm. That's an interesting one. Um, so, at the risk of repeating myself, I would say again collaboration. First, they need to policymakers across the different countries in Africa need to see maternal mortality and healthcare as a clear and imminent danger that requires immediate attention and action. And again, collaboration is the way to go. They need to uh, you know partner up with again, that is one thing about Africa. We are very resilient. Most times you don't really have to wait for the government. You have different silos of community development, community initiative, individuals, groups, non-profit, do what they can in different silos to solve this problem. And so the government needs to collaborate with these different silos of practices to ensure that these problems are tackled. And we need to start designing primary healthcare centers and healthcare facilities in general with off-grid energy sources, right from ground, right from the start. That will help curb all these problems in the long run.
Thank you. Farai, thoughts?
Yeah, for me, I think we shouldn't be losing mothers, or we shouldn't have mothers being turned away from a clinic just because there is no power. In 2026, it just can't be. It's unbelievable. And so the government should own up projects like this. The government should scale up, build more off-grid solar power stations, solar power plants across the country, and they should not wait for donors. I think we have learned a lot with the US funding cuts. that we can't rely on donors. The government can't neglect its duties, thinking that that donors will come in. Some of the money, it's not even much. The government has this money; they can use the taxpayers' money to fund projects like this.
Awesome. Thank you so much for that. I hope they are listening. That's really the idea for this. So yes, we do our part. We pull in colleagues, like you both to have this conversation, but we also leverage our platform to push it out there throughout the Nigeria Health Watch channel. So we're hoping that they get to see some of these recommendations. We know there are recommendation solutions everywhere, but we keep pushing them out because it's not a one-off engagement. And that's essentially why this conversation matters. So thank you so much for making our time to share insight, dive deep into this important reporting that you did, the intervention around using renewable energy at the PHC level to improve access to maternal health care. Thanks so much, Chinonso, and thank you, Farai, for your time.
So much.
Thank you for having me, Chibuike.
Okay, good. So this has been made possible by Nigeria Health Watch, the Journal Conversations podcast series. You can get us anywhere you get your podcast, and please do reach out if you have any thoughts, any contribution, any solution really that you want us to talk about, or something that is working around you, or even not working, because we believe if people don't know about the issues too, we talk about them. We don't shy away from talking about them. But the conversation now becomes, if the problems are out there, we now start asking what's working. Do we know enough of what's working so others can learn? So you can reach out to us through any of our social media platforms, just Nigeria Health Watch, and we will show up, or podcast at nigeriahealthwatch.com. It's been a pleasure hosting this episode, and my name remains Chibuike Alagboso. Thank you, and over.